This is Marcos Patchett, the nocturnal herbalist, and in this video I'm going to be talking about ways to treat cancer, and specifically a model for the holistic treatment of cancer that's addressing it on every level, from the level of symptoms and symptomatic level all the way down to the level of sustaining factors and causes. Now, disclaimer before I get into the video, I'm not suggesting that this model in any way means you can neglect conventional treatment or conventional medicine. In fact, this model is, and also I'm not suggesting this model guarantees success, but I hope you'll see as the video goes on that it stands to reason and that it is a model which should enhance any chances of successfully defeating cancer or getting the best prognosis. And also it's a model that can be used by anyone, by conventional oncologists or by complementary practitioners. So yeah, anyway, that's my position. So hopefully you'll see what I mean. Level 2, the sustaining factors, we've got things which might be very helpful there. So sustaining factors of disease, as I say, in terms of symptoms, they're symptoms that go along with the main disease, such as fatigue or weight loss or whatever, depending on the cancer that you've got, breathlessness or diarrhea or whatever it is. And certainly you can address those symptoms with plants. And what I tend to do in such a case, and I suspect most other herbalists do, is try to make sure that the plants that you're giving to help those secondary symptoms are also have some anti-cancer activity appropriate to the cancer, because you might as well. The big limiting factor, of course, is that if a client or patient is on chemotherapy, you have to make sure that the plants don't interact with the chemotherapy drugs. And in many cases, you can't really give many plants because a lot of plants are contraindicated with chemotherapy drugs because they could potentially interfere with them. But there is stuff you can do. The major thing, or the major class of plant drugs I really want to highlight for that symptomatic benefit, and particularly for enhancing general survival benefit, would be a class of plant drugs called adaptogens. The name, I think, was coined by Professor Brekhman, who was a Russian scientist in the 1970s, who did lots of research on Korean ginseng, Panax ginseng, and on so-called Siberian ginseng. It's actually not a ginseng at all. Professor Brekhman found that there were certain plants that he called adaptogens that helped the body adapt to stress and actually enhanced survival when an organism was stressed. So they essentially, whatever kind of stress the animal was undergoing, physiological stress, you know, so light, dark stress, cold stress, heat stress, stress from diseases, they universally enhance survival. And this term hasn't been accepted by mainstream medicine, but there is an absolute plethora of research evidence for these plants working, certainly in animal experiments. In human experiments less so, but it does exist. Most of these plants increase stamina, for example, producing distinct advantages in things like relay races because they slightly improve the performance of many people. And in fact, Siberian ginseng, Eleutherococcus, was given out to factory workers in the USSR one season because they found, just an experiment, they dosed thousands of factory workers with it, and it reduced absenteeism due to flu. So of course they started giving it out every year, and it was included in their space program. It was part of the package for their astronauts and so on. So these plants are really, really useful. And there are two, so they basically help to restore homeostasis or bring the body back to normal if it's stressed. And they do so via quite a diverse array of mechanisms. The research in ginseng, for example, shows that the compounds in ginseng resemble some of the body's hormones and bind to an area of the brain called the hypothalamus, which is the body's hormone thermostat, essentially. And it makes the hypothalamus more sensitive, so that when you've got too high levels of cortisol or stress steroid kicking around, it'll damp down the release of cortisol, and when the levels are too low, it'll amp it up, with the net result that the response of the stress system gets tighter. So it's more economical. There's less waste of the body's resources. So over time, it can preserve health under conditions of stress for longer. So that's an observed mechanism for one of those plants at least. Many others contain different compounds and their mechanisms haven't been noted. The thing that unites all the plants in this category is that they all have this ability via various mechanisms to reduce the effects of stress, negative effects of stress. So there are two that I want to draw attention to, particularly for cancer, because both of these plants have been found to have very few interactions with conventional medications, and singly or in combination singly or in combination they are very useful for improving survival in cancer, and I'll put some links in the description box below the video on YouTube. Okay, so there will be some appropriate links there about adaptogens and these two plants in particular, and they are Ashwagandha, or Withania somnifera, a herb that is very important in Ayurvedic and traditional Indian medicine, and Astragalus, or Huang Qi. Sorry for my Mandarin pronunciation, which is non-existent to any Mandarin speakers out there. Huang Qi, or as I call it, Huang Qi, which is a traditional Chinese medicine. Technically, ashwagandha is an adaptogen. Astragalus, although it's frequently described as one, I would say it isn't. It's an immunomodulator, but it's frequently included in the category. The reason I say ashwagandha is, but Astragalus isn't, is ashwagandha does definitely improve exercise performance, whereas I don't think Astragalus does. So the main active constituents in ashwagandha are called withanolides, and they are described as steroidal lactones. These are compounds in the plant that resemble human steroids, human stress hormones. They have a similar structure to human hormones. I'll put a picture on the screen comparing the structure of cortisol, which is human stress hormone, to a withanolide. And you can see that they share a similar structure, a similar shape. And that is true actually of a lot of compounds from these adaptogens. It's true of the ginsenosides from ginseng. It's true of, I can't remember what you call them, glycyrrhizin, and the compounds in licorice, Glycyrrhiza glabra, which also have adaptogenic effects. But they bind to steroid receptors in the human body, essentially human hormone or steroid receptors. So one of these steroidal lactones in Withania, Withafferin A, there's a small open clinical trial in breast cancer, women with mostly stage 2 and 3 breast cancer. That means it's not just local anymore, it's spread to the local lymph nodes or even a bit further. And that they used 2 grams of Withania 3 times a day, so 6 grams a day of powdered ashwagandha root. And they did that with 6 cycles of chemotherapy. So it was used alongside chemotherapy for breast cancer, and they found it made a significant difference to, I think, fatigue and quality of life. It improved quality of life and significantly reduced fatigue as compared to the control group. And it didn't have long-term survival benefit 26 months later, but it did have survival benefit up until quite soon before then. Now, the thing is with this trial, they only kept on with the ashwagandha while the women were receiving chemotherapy. They stopped it afterwards. So my question would be, had they continued the ashwagandha after the chemotherapy, I suspect that the long-term survival benefit would have been more noticeable, because if you look at the paper, and I'll put the link in the description box below the YouTube video on YouTube, if you look at the link, you will see that if you actually read the whole paper, you'll see that there was a survival benefit for the group who received the ashwagandha up until several months after the trial. And at 26 months, that dropped off. Well, by that point, they had been without the ashwagandha for several months. So I suspect that had the ashwagandha been continued after the chemotherapy, that survival benefit would have been more marked, because there was one up and in the sort of intermediate period. But I don't know that for sure. But what we do know for sure is that the ashwagandha certainly improved the quality of life and decreased the fatigue, which is one of those sort of second tier symptoms. Immune function in cancer, and what have I got for this? I think it increases the radiosensitivity of cancer cells, so it increases the cancer cell susceptibility to radiation, and increases the cytotoxicity of chemotherapy. That means it enhances the ability of chemotherapy of many different types to kill cancer cells, while also reducing negative effects of chemotherapy on bone marrow. In other words, it helps to preserve the natural immune response, the natural level of white blood cells. Now, it doesn't mean that it will entirely protect, it will not totally reverse the chemo. I often say that trying to totally get rid of the side effects of chemo using plant drugs is like trying to stop a tractor with a teaspoon. It ain't going to do it, but it does help. It does help. Okay, what else was I going to say? Oh yeah, back the ashwagandha, I've got some numbers here. At 24 months, the ashwagandha, there was 78% survival in the ashwagandha group versus 56% in the non-ashwagandha group. So, like I said, that survival was greater up until, and then 26 months it had sort of equalised. So I suspect had they carried on with the ashwagandha, even greater survival as well as symptomatic benefit. But anyway, if you want to read more about adaptogens in general, there's a great book called Adaptogens by David Winston and Stephen Maimes, and again I will put a link to that in the description box below the YouTube video. Fantastic book full of information on those things, on those plants, but those would be the two I would suggest. Like I say, the dose for ashwagandha used in the trial was about 6 grams a day. Now, what have we got for Astragalus? An open trial of 120 patients of some kind of malignant tumour. This was a trial done in China, and they're often not very good with reporting accurately what kinds of cancer people have. It's a bit problematic because it's an open trial. In other words, there's no control group. But an open trial is not without value because it does tell you how something is likely to perform in real life. It just doesn't tell you what degree of that performance is due to the substance and what degree of it is due to placebo or mind over matter. But it does tell you how well it does in real life. In this trial, though, they gave the astragalus an extract through a saline drip. I wouldn't recommend you try and do that at home. You might end up dying. Don't sort of try and make some astragalus tea and give it to yourself through a drip. It will cause problems. They had in China they have hospitals which produce special herbal extracts designed for intravenous use with all the things that can cause problems filtered out. And it's for 21 days, and they gave them four courses of it, and it delayed the progression of cancer. There was a slower decline in white blood cell levels, so the immune system was helped, and improved CD4 to CD8 ratio, which basically means the immune efficiency was preserved a little bit. And it also improved the Karnofsky score, which apparently is the Karnofsky scale is a measure of the ability to look after oneself. So it improved the functionality of the patients. Obviously, I mentioned the limitations of the trial. It was open, no placebo group. That's a bit problematic. And of course, it was intravenous, so it doesn't necessarily tell you much about what happens when you take it orally. So there's less clinical validation for the astragalus, but in terms of the in vitro, meaning in the laboratory, and the animal work, there's substantial evidence for its use as an immune stimulant, an immunomodulator, and it's very safe. It's pretty much food grade. In terms of contraindications for those two substances, ashwagandha don't use if you have hyperthyroidism, that is a high thyroid, because it can accelerate the thyroid a bit. And in terms of astragalus, I wouldn't use it if you have autoimmune disease, or if you, in terms of lymphoma, it's a little bit sketchy. I maybe wouldn't, just because in lymphoma it probably would help actually, but I wouldn't rely on it, because lymphoma is a cancer of the immune system and there are loads and loads of immune cells going around, so taking an immune stimulant might not be a great idea. I suspect astragalus would help because it might help the normal immune cells eradicate the cancerous immune cells, but I wouldn't rely on it. Don't know, so avoid it in lymphoma and avoid it in certainly in autoimmune conditions, and in any condition where you need to keep the immune system suppressed, such as following an organ transplant. So if anyone is unlucky enough to have a cancer after receiving an organ transplant, which can happen, because if somebody happens to receive an organ that already has some cancer cells in it and then gets put on immune suppressive drugs because they don't want the immune system to reject the organ, that can happen. But if you're in that position, you can use the ashwagandha, but I wouldn't use the astragalus. Okay. And doses, ashwagandha is 3 to 6 grams a day recommended, and the astragalus is 6 grams a day, and you can get them both. The cheapest form to get them, either of them, is as a powder, and take them as a powder, but there are various dose forms available, but those are the two substances. And before you take any supplement, always check with the hospital pharmacist. You can check with your oncologist if they're open to you using herbs. Many oncologists, not all, some will be open to it, many will not be, and some, if they don't know, will just say no, because they think just say no is a good idea. I don't, so ask the hospital pharmacist, because hospitals have a database, the pharmacists have a database they can access and check for contraindications with any other drugs you're prescribed. So my suggestion would always be, if you're interested in taking a plant, check with the hospital pharmacist and they can check it on their database. And then if the oncologist wants to argue with you, you can produce a bit of information that says, no, it's fine. So anyway, politics, whatever. So, and then, we have one more bit of information for the astragalus. Sorry, it's my notes. Like I said, they're written awfully, as usual. The astragalus with chemotherapy, in this case a chemo drug called cisplatin, it significantly reduced tumour growth and prolonged survival in animal experiments. But so this is in animals, but again, I would say this is a very useful piece of evidence, because this is a food grade drug. It was being administered orally to these animals. The animals were given the same chemo drug that's given to humans, and it enhanced their survival and enhance the efficacy of the chemotherapy. So you want something like that that's going to, make the drugs more likely to work and you more likely to live.